So the skin is exposed, and we see problems of pigment in the skin, either too much pigment or too little pigment. And we spoke about before the disease, an entity called vitiligo. And in communities that are, in ethnicities that are dark-skinned, this is a real problem. These patients, or these people are going to be taken away. They're going to be ostracized from the community. Nobody's going to marry them, for example. Nobody's going to, because they have this, well, they're going to think their children are going to have this, and it's not socially acceptable. So like I said, we use strong topical steroids for 2 or 3 months, and that'll enhance the pigment coming back. We also have our narrowband UVB light therapy, which we could apply locally. Could be applied just locally, these patches, or if it's all over the body, we put them in the booth and they get the rays all over their body. The other option is just, sometimes they get it just on their hands and on their feet. So you have like a hand-foot unit. So if it's just on their hands, we can just treat the hands. You don't have to have it all over your body. If it's just on their feet, we have a machine that you can just put in their feet, and it hits the tops and the bottoms. Has lights on both sides. So we could treat it locally, or we could treat the whole body, depending on what it is. It's a really, really tough disease to treat. It's very hard. Sometimes we inject these with steroids locally, and that'll stimulate some pigment to come back. Sometimes we throw the psoriasis medications at this, like the vitamin Ds, and we use that in combination with steroids, and we treat it with those things. And we try multiple therapies. So we figure, okay, we're not sure which one is working, but we'll throw all 3. We'll throw the Army, the Navy, and the Marines all at it, and eventually something will come up. Here's also what we see, this is called the mask of pregnancy, or melasma. And what I find the best is, again, combination therapy. And lasers have worked well. Microdermabrasion, chemical peeling, which our estheticians offer, work well. But a combination topical treatment where you have retin A and hydroquinone in very high strengths, they're going to be applied initially once a day, because it's very, very irritating to apply this 2 or 3 times a day. Initially once a day. And you kind of work up after a month to twice a day, and even 3 times a day when it's really, really bad. And we've had great success by having a pharmacy in California actually compound this product for us that has a good amount of retin A, about 7-8% hydroquinone. You can only get 2% hydroquinone over the counter, and it doesn't work. The ladies at the Nordstrom's counter, the clinic counter, tell you to use this, but it really doesn't work. They have a little bitty amount of kojic acid, a little amount of hydroquinone, but not enough to have a clinical effect, a good result. Even if you use it for years and years, it's still not enough there to do the trick. So we take all these, we combine 2 or 3 products in one, and that's what works great. Sometimes I've had to combine about 7-8 products, including vitamin C and different bleaching agents at high concentrations to really get an effect for some of these ladies.